So thank you so much for inviting us to come speak here today. My name is Matt Reddy, and I've worked at Jefferson Healthcare the last 15 years. It is a wonderful institution. I've really enjoyed my time there. So for the last 15 years, I've worked as a problem solver at Jefferson Healthcare. At first, I was in the computer department. In the last 7 years, in what's called the performance improvement department. I'm very good at solving problems and making processes better. I'm running for hospital commissioner because about a year ago, I came across a problem that is not easy to solve, and I really want to solve it. About a year ago, I discovered a friend of mine had an excruciatingly painful medical condition for which she would not seek medical care due to cost. She was already paying off medical debts to Jefferson Healthcare. She did not qualify for full charity care. And so instead of going further in debt, she decided to roll the dice with her health, which I've discovered since a lot of people are doing. I've learned since then that, in fact, between 1 in 7 and 1 in 3 people in our county are doing a very similar thing. We have expecting mothers refusing ultrasounds due to cost. We have patients refusing x-rays and MRIs. We have patients unable to get the medications and equipment they need to take care of their chronic conditions. The hospital does have a charity care program that does help a lot of people. But for too many people, we say to a patient, instead of this $5,000 bill you can't pay, we're going to give you a $2,000 bill you can't pay. And then the hospital thinks it's doing $3,000 of charity right there. But the patient still can't afford it. And so they learn not to come in for their care. As hospital commissioner, I'm going to make access a top strategic priority and work relentlessly so we clearly see the healthcare needs of our community. And I'm going to insist that we pursue innovative, affordable access programs. So thank you so much for having us here today. I look forward to your questions.
I neglected to mention that Jackie Assey from the League of Women Voters is here and has timing cards, so pay attention to her. She has a 1 minute left sign and then a red sign that says time is up. So if you'll keep an eye on that, I appreciate it. Thank you. Mark.
Good afternoon. Thank you for inviting me to speak today. Again, I'm Mark Wanning. I've been on the Jefferson Healthcare Board of Commissioners since 2008. I'm sure many of you have noticed some of the great changes that are occurring at Jefferson Healthcare, such as our Swedish affiliation, some of the minor campus renewal projects like better hallways, better signage, better parking lots, our really nice new cafeteria, and of course our really great new chef. Some of you probably are aware that morale is better among some of our employees now, particularly if you are neighbors or friends with some of the people that work at Jefferson Healthcare. I hope none of you have had to use any of our new services, such as the walk-in clinic, our new cancer services, our new orthopedic rehabilitation swing bed unit, or our Port Ludlow clinic. However, there are many accomplishments that you probably are not aware of, such as we are nationally DMV accredited now. We have College of American Pathologists certification of our laboratory. We were named by Consumer Reports as one of the top 7 hospitals for surgery in the state of Washington. That's based on Medicare data. We are one of only 148 hospitals nationally to attain the designation as baby-friendly by the World Health Organization. We've attained financial stability for the first time in 25 years, so we're able to look at wonderful new projects like the new emergency and specialty services building, and we're able to do that without asking for public money. We can continue to take care of everybody in Jefferson County, regardless of their ability to pay, because of this. These are some of the reasons that I ran 6 years ago, and these are some of the reasons that I think you should re-elect me. Thank you very much.
Thank you for taking time out of all of your busy schedules to come and to the chamber and to listen to all of us speak on the importance of hospital commissioners. My name is Savannah Hensel. 1 in 7 people in Jefferson County did not receive the medical attention they needed last year because of the cost. I am one of those people, and I have cared for many in the same position. As a home caregiver, I have firsthand experience arguing with insurance companies over the phone, trying to get my grandmother the care she needed while she was dying of cancer. Working as a nurse's assistant in town, I have watched countless families refuse care for their elderly loved ones because of the cost. And as a working single mom, I know what it is like to live in this community without health insurance, to avoid seeking care, and to be hounded by our hospital's collections agencies. I will use these fresh fresh, contemporary experiences to advocate for changes vital to the health of our community, like making costs transparent to hold the hospital accountable for its billing practices, to let the people know exactly what they're getting into when they seek care. By also providing mental health resources for our ER staff, because many people sent it to ER have overlapping mental and physical health issues. And also by providing education and training for caregivers. Because of the growing cost of assisted living, more and more people are choosing to care for their loved ones at home. Our hospital district is well positioned to teach this growing segment of our community how to physically and emotionally care for their loved ones. Finally, we need to reinstate programs that were neglected by my opponents, like the Health Data Advisory Committee, because without knowing what the problems are, we can't fix them. And also the rural OBGYN program, because the sooner we can access rural women, the healthier our future will be. Thank you.
Hi, and thank you for the opportunity to speak about Jefferson Healthcare. For 3 terms, I've worked hard as your commissioner because I believe that high-quality basic health care is the foundation of a viable, thriving community. During my tenure, I've gained in-depth knowledge and experience of the industry and how to make it work for us locally. As a result, Jefferson Healthcare is financially strong. In 4 years, reserves have increased, cash on hand has nearly doubled, and assets improved by 50%, all without any increase in tax levy in 4 years. We are dedicated to caring for every member of our community, regardless of their ability to pay. We have never, ever turned anyone away due to lack of income. We are responsive to our patients' needs. During my tenure, we hosted public forums asking you, how can we do better? You asked for more access in a walk-in clinic. We heard you and added 5 clinics. You asked for new services. We heard you and added 7 new services with more to come. And we are an award-winning leader on national and state levels. Consumer Reports ranked as top 7 in Washington State for surgery, along with Swedish, UW, and Providence. We have the highest patient satisfaction scores on the peninsula. But as much as we've accomplished, there's more to do. The Affordable Care Act is the biggest reform in healthcare in 50 years. Its impact is huge and complicated. There will be pitfalls along the way. Experience and understanding are critically important as we work to implement the Act to improve the lives of thousands of our patients. We have to get this right. I'm ready to use my experience on your behalf for a successful enactment of healthcare reform as it affects our community and our hospital, and I need your vote to do that. Experience and actions count. Thank you.
Okay, well, now we turn to questions from the audience. Who wants to be first? Yeah, sure.
So, what are some of your ideas on? What are some of your ideas on making? I don't think it's on.
No, this is just.
Oh. You're gonna be on the news or something.
This is on the record.
Oh, on the record. What are your ideas on making affordable health care work, and what are your concerns about it? It seems to be a concern, and Dr. Kristen, I guess. What are your ideas on that?
Yeah, we'll start with Jill down here.
It's a very complicated.
The question is, what can you do for to make the Affordable Care Act work, and was that basically it? And avoid the pitfalls.
Yeah.
What do you see coming that will be a problem?
What will be a problem? Yeah.
We have, it is a very complicated issue, and it will be difficult to implement, but we've got to get this right. And what we will be doing and what we are doing is hosting a series of forums on how to get people enrolled. That's going to be critical to us, because the government, part of the subsidy that is helping people get affordable insurance is going to come from the hospital. The rationale being, well, if we have less charity care, then we should be able to give some back. And so that's why it's going to be very critical for us to enroll everyone we can, and we are actively doing that with seminars and helping. We have a person dedicated on staff now to help, so that's going to be the key.
So, yeah.
I believe the Affordable Care Act does many good things, but some things I think people don't understand is that it's still quite expensive and it will underinsure a lot of people. So there will still be access issues for many of the people who live in our county. And something that I believe in is trying to get single-payer universal health care. Through the Affordable Care Act, we are given the opportunity to create a system like that here in Washington State. And currently there's a bill going through Olympia, created by a woman, Sherry Allison, over in Kitsap County. And our commissioners could really be advocating for that and endorsing it and helping to get this bill passed so that everyone in Washington State, and especially in Jefferson County, has access to all of the health care that they deserve.
I think Jill has already spoken a little bit to what Jefferson Healthcare is doing to implement the Affordable Care Act. We have financial counselors on board, and they're really going to be dedicated to helping people find the right plans. I think that one of the biggest blocks to access is not people being able to get that access, but not realizing that there are all kinds of programs out there that they're already eligible for. And one of the things the hospital is now focusing on is trying to make sure that those people do access those programs that are in place. And the Affordable Care Act is one more of those. Not just is Medicaid being expanded, so the so-called health care for the poor is going to be a lot better. In the past, there were all sorts of other requirements besides your income to qualify, and that's going away. So everybody with incomes below 128% of the poverty level will immediately qualify. Now, the subsidies up to 400% of the poverty level will be out there. I think Savannah's correct. It's not free. Healthcare is not free. Healthcare is expensive. But we're going to do everything we can to make sure that people get the benefits they can. Thank you very much.
Yeah, so there's a lot of people at Jefferson Healthcare working to adapt to the new laws of the Affordable Care Act, just like they always do when laws change, and we're doing a great job of it. But the Affordable Care Act was a huge compromise. It takes the monster of a healthcare payment system we have and turns it into a different shaped monster. It doesn't get costs under control. We spend twice as much per person per year than other industrialized country on healthcare. That's the problem. We need to bend the cost curve. And the only way you can do that is probably with something like some sort of single payer universal healthcare system. And the hospital commissioner should be advocating for that. I met a man at the Jefferson Fair who cannot get the medical equipment he needs. He's on Medicare, he's on Medicaid. Neither of them pay for the medical equipment he needs. And the Affordable Care Act is not helping this man. And who's advocating for him? Who is looking at him and saying, he's not getting the equipment he needs, he's been waiting a year. We need someone on the board that sees these people that aren't getting the care, has them on a list, and is working to come up with programs to help them.
Next question. Yes, John.
Several of you have mentioned the importance of getting out and advocating, and I'd like to hear from all four of you, if you have the time to be involved in community activities like the Board of Health or other organizations outside the hospital. Do you have time to do that, and will you do that if elected?
We'll start with you, Matt. Come this way.
Absolutely. I mean, as hospital commissioner, you have to be the advocate for 30,000 people and their healthcare interests. So, I mean, in addition to participating possibly on any boards that would invite me, I'm going to continue to communicate with state representatives like Sherry Appleton, who I went and met with. And one of the reasons it was easy for me to get a meeting with her was because I was a candidate for commissioner. Hospital commissioners have more access than individual citizens. So we should use that power to get through the doors and talk to our representatives and talk about the big healthcare reform we need. Now, my opponent says it's actually arrogant and absurd to think a hospital commissioner should talk to our legislators about the big healthcare reform we need. But I think it's absurd to think we shouldn't be. If they're not going to listen to a hospital commissioner representing 30,000 people, what chance does an individual citizen have to be heard by our representatives?
We already visit Olympia and DC, but we don't do it alone because we have no access or authority alone. We go in conjunction with the Washington State Hospital Association and the American Hospital Association and our fellow rural hospital commissioners. And we do have limited access, in spite of what Matt says, but we use that access very wisely, and we use it to lobby for or against those issues that affect rural health care. If we go in and start being irrelevant, we lose our credibility, and then we lose what little access we have. So yes, we're very active in going both to the state and federally. And I think we're also active locally, both just being out in the community. I have children, you know, in sports, etc. Jill sits on the public health board, so I think that's obvious that we participate in the community. Thank you.
If I'm elected, I definitely plan on being on boards and advocating for people. And that's something I've done through my election. I've met with the director of Jefferson, the Department of, the health department. I met with Jean up at the health department. I've met with the director of Jefferson Mental Health already, trying to reach out farther than the people I already know in this county who already have access issues, to get more knowledge of what other gaps we have in our community that need to get filled. And so I'm more than willing and am going to tirelessly talk with people and hear stories and to hear what everyone's needs are, so we as a community can start making the hospital better.
I actually am on the Board of Health. In fact, I chair it this year. And I'm also on the Mental Health and Substance Abuse Advisory Committee that recommends allocation of funds for organizations that serve people that have those issues. So I'm there working, I have been for the last few years, working in that arena already. I've proven that, and I am knowledgeable about it, and I continue in as far as being politically active. I do advocate, and I have for 14 years gone back to DC and to Olympia to fight for rural health care. But as Mark said, we do not have the authority to make law. We only have the authority to help our elected officials that do have the authority to make the law understand the ramifications of the laws they make as it affects rural health care. That's what we do.
Yes, Paul.
Paul Richmond. Among other things, I'm a lawyer who does a lot of work representing people who are facing debt collectors and other consumer complaints. The largest volume of debt collection cases I'm getting is from this hospital. And when I'm listening to the two sets of candidates, I'm hearing one set that's saying, we need to address this, and another set that I'm hearing seems to be saying, the problem doesn't exist. Do the candidates up here all believe that a problem exists with that? And how do we take concrete steps to address this?
Let's start with Mark this time.
The Affordable Care Act goes into effect in 3 months. Everybody is mandated to have health care insurance. Everybody should have coverage. I think that everybody has to take some responsibility for paying for health care. And the new law is just that, is to provide universal health care. I realize that people have had debts. I can't make those go away. I live in Jefferson County. I'm not Senator so-and-so. We have to live within the realities of this county. I don't see any way that we can pay everybody's out-of-pocket expenses without raising millions of dollars of new taxes annually. I don't think that this county has the will or the way to do that. But again, the Affordable Care Act is going to take care of most of this problem.
Matt, you want
So the answer is no, my opponent does not see this as a problem. It is. People are sent to collections. They know this. Like I said in my opening, we turn to a person and we say, you get partial charity care. You know, your $5,000 bill, we'll turn it to a $2,000 bill. And the person still can't pay it. They're sent to collections. Over 80% of the people we send to collections, these are for bills under $5,000. We have to do something about this. And like I said, the way to measure it is you measure who is not getting the health care they need due to cost. We got to try to see these people. We need to have a list. Someone's job should be, let's have a list of the people not getting the care they need due to cost. We should tell our doctors, if someone refuses, an expecting mother refuses an ultrasound due to cost, put her on the list. If someone's not getting an MRI or an X-ray, put them on this list. We could do a hotline like they did in Howard County, Maryland, where people call if they're not getting the health care they need. Now, and then you treat the list like you do a transplant list. You prioritize it. And then we put some money aside and try to help as many people as we can. And Mark's right. We won't have enough money to help them all. And then it's the commissioner's job to go to Olympia and say, we need more help. We need different laws to actually solve this problem.
Ben?
To answer your question, Paul, I can't see you, but yes, it is a problem. And it's a problem for many of people I know living in this county, not just young people and families, but also elderly people and even business owners. And it's something I've lived through. I've been sent to collections because I couldn't pay the remaining fee that was left after getting care from the hospital. And one way to start fixing it is by making costs transparent at the hospital. If you make everything transparent, sit down and talk with people and really let them know what they're getting into and help them make really good choices so that they feel empowered with their health care and their finances and their ability to pay for it instead of leaving them with a debt they're unable to pay for. It's a really hard place to be in, to choose feeding your family or going to a doctor because you have an illness. And many people in our county make that choice every day. And let's make everything transparent to start with, and then go from there.
They're all right, we're all right. Healthcare problems are the #1 cause of bankruptcy, we know that. The solution is not as easy as it seems. There is no such thing as free healthcare. Somebody's got to pay it somewhere. Unless you can get all the doctors and the nurses and the housekeepers and the maintenance people and the people that do the supplies to work for free, somebody's got to pay somebody to provide the care. So I think the Affordable Care Act is a step in the right direction. Is it a panacea for everything? No. But it's a step. And yes, it is a problem, it does exist. I've been there, I've had the same. I was a single mom. I understand where my opponent is coming from. But it's not, you can't just go pick off the tree to get money off the tree to pay for this. Anyway, the Affordable Care Act, I think, is a step in the right direction. It's the only thing we've got going right now.
Yes, Dominic.
I work for a bank and have pulled credit reports for a number of applicants, and probably about 2/3 of those are due to medical collections. They are not able to get financing for things, not able to even start rebuilding those credit. They last on there for 7 years. What I'm curious about, most hospitals allow 3 to 6 months at maximum for payment plans for repaying those debts that can't be paid. And beyond that, once it goes 30 days beyond them not making a payment, it immediately goes to the credit report, which then can't be fixed for 7 years. What could be done at a local level to either extend the amount of amortization for payment plans for medical bills, or come up with some different system so it doesn't have such a dramatic negative impact on their lives?
Start with Savannah.
If the minimum payment to pay off your medical expenses is too high, that means we need to lower the minimum payment. I know of a service in town where that does offer sliding fee, and if the minimum payment is too high for their clients, they sit down with them and look over their budget and say, well, what can we help you pay? What can we do to help you pay without making this a hardship? And that place has gone down as low as $5 a month for some people in really extreme cases. And that is something that we really need to look at and start addressing, because obviously the minimum payment is too high for many of the people who live here.
Joe?
We do have financial counselors that will help and work with people. We have never ever turned anyone away, and we have never ever collected, taken somebody's house. We work with people. We do try. It's very difficult because it is. You know, how do you, when you're sick, I know that people talk about tests and the expensive tests and too many tests and all of that, but when you're sick and you need that, you need it. You need to have that. You can't just say, well, you're going to make a choice. And transparency, we are transparent. We are. If you go, you find out how much any test is, you have to ask. Our doctors have no idea what the test costs. They don't know when you come in whether you're a commercial payer or whether you're indigent. We make it that way. We want the doctors to treat every patient the same. So, and they do. So it's the responsibility of the patient to say, can I afford this? And what's the cost of your life? I mean, what's the cost of good health? You know, what is the price of good health?
All the way down to Matt.
That was a great question. Yeah, you know, one of my goals would be to actually watch collections, you know, as a measure of the success of the hospital. You know, I would love it if in 6 years the hospital is not sending anyone to collections. That's really where we should be. I met with Sam Markow of Jefferson Mental Health, and they work with people. They try not to send anyone to collections. They do what Savannah said. They take it all the way down to $5 a month. You know, I mean, that is why people are afraid to come in for health care, because they know if they can't afford it, their credit will be destroyed when they're sent into collections. I want to be more flexible. Snoqualmie Valley Hospital, they created an affordable access program. They went to people that couldn't get insurance, and they gave them a type of subscription. They gave them like $10 a month or $20 a month based on your income. Then if you pay that, you will be able to go to the doctor for like $20. They made a reasonable program, and we could do something innovative like that potentially. So.
I agree with Matt. It would be great if nobody had to go to collections, if everybody paid their bills and were able to pay their bills. The reason we have charity care policies that are liberal is so that we can deal with people on an individual basis when they have bills they can't pay, and so that they can qualify to not pay those. I don't know the specifics of your question, and I'd like to look into that. I see no reason why we can't extend payment plans out greater than 3 to 6 months. That seems short, and I don't know what we do, and I'd like to look into that. So, again, I'd love to send nobody to collections. I'd like charity care to work perfectly for everybody. It is a case-by-case basis, and we do have very liberal policies. Our charity care has increased from under $2 million to almost $10 million over the last 6 years. It's skyrocketing. What can I say? Thank you.
Next. Yeah, Jeff.
Thank you. What are the present deficits in the hospital for care of mental health patients in crisis, and what would you do to cure that?
Let's start down there, Matt.
The hospital doesn't really have much in the way of mental health services, and it's another huge gap in our community. If you talk to anyone that works in our emergency room, they get hit by mental health patients on a daily basis. I met with Sam Markow again talking about this. What we desperately need in our community is an inpatient mental health facility. And Sam Markow, he's talked about somehow getting a 4-bed inpatient mental health facility, because what we do, these patients come into our ER, we're not fit to take care of them. If we have to admit them, we're not set up on the ACU to take care of them. It is so hard to get these patients in anywhere, and when we do, we ship them over the water. They get medicated for a few days, and then they're released, and they're back in our community. They have no continuity of care. They need to have something. The purpose of an inpatient facility is to establish, solid continuity of care, so we can really take care of these people. Mental health is a huge issue, and it will be a priority of mine. Mark?
I think this really comes down to Jefferson Healthcare cannot be everything to everyone. We have limited resources. We have a small community. We cannot start doing open heart surgery. There are many services we can't offer. It's rare for a community our size to have inpatient mental health services. And I think that there are good reasons for that. I think that we don't have the finances or the expertise to handle these kinds of patients. There's no question they're a problem, and I wish that we could do everything for everybody, but we just can't.
I agree with what Matt said. I think if our hospital is willing to spend millions of dollars to build a new building, why not build it to fit 4 beds to serve the mental health needs of our community, so people aren't ripped away from their families and then brought back with no idea where to go next. Being a rural hospital, I think it's our hospital's job to look at what the gaps in healthcare are in our community and really step up to fill these gaps to make sure that the needs of everyone in our community are met.
Actually, our expansion would take care of one of the elements that we've been discussing in mental health, and that is a safe room. Most emergency rooms have a safe room where people who are have mental issues or have substance abuse issues and are acting out can be safe and held without risking the health of the caregivers and others around them. And that is one of our priorities for our expansion, which will include an expansion of the emergency medical services.
Sure.
How much does Jefferson Healthcare spend on advertising, and do you think advertising is an appropriate use of funds when you could use it for buying down the cost or adding services?
I don't know what the budget is on advertising, but I can tell you that it's an important part of what we do. When we did our community forums out, and we hit every part of the county, and the number one issue that we saw was that people weren't aware of the services we have. So in order to get more patients and get our community and where we can serve them, we have to make them aware. So it is, and I think that's a very important part of what we do. It's the business side of healthcare, and it is important.
I think advertising is an important part of letting people know what services our hospital offers. But if that isn't working, then let's try other things. Let's door knock. Let's talk to people. Let's have phone trees. Let's get out in the community. I mean, everyone in this county elected the people on this board. You know, we should be working with you to hear what you think needs to improve at the hospital. And if I'm elected, I will knock on everyone's door in this county to tell them what services the hospital has to offer for them. Because if they don't know, then how can we help them?
Mark?
The reason why advertising is important, and again, I don't know what that budget is either. We have a $70 million budget. About half of that is Medicare and Medicaid. The rest of that budget is made up by commercially insured patients. Only about $400,000 of our total budget, about 0.5% comes from tax revenue. So we depend on the commercially insured patients, and by the way, Medicare and Medicaid don't even pay the entire cost of their care. So we depend on the commercially insured patients to make up for the expenditures for bad debt, charity care, and capital expenditures, new equipment and buildings. So it's really important that we attract those patients to our institution, and advertising is just one way to do that.
So I agree, we need to do advertising, But I also agree it's kind of absurd to have full-time employees working on advertising and not have full-time employees working on access. There are members of the strategic leadership group is in charge of marketing. How about we have a strategic officer whose job is access? Your job is to measure the access in our community and come back to this, research what every other community in the country is doing to try to take control of this problem, research what Howard County, Maryland put in their health improvement plan to try to get access under control, and come back to leadership and the board and present your ideas and make the case. And apply for the money we need. When we were talking about mental health, Sam Markow told me there was $25 million available from the state to fund mental health facilities. We could have been advocating for that, trying to get $5 million here to try to do something, but instead it just went to the big facilities over the water. So.
Another question? Yeah.
Under the Affordable Care Act, I understand that there's going to be incentives for preventative care compared to treatment of illness. What role do you see for Jefferson Healthcare and preventative care in our community?
Matt, you want to start with that?
Well, it depends what you mean, incentives for the hospital or incentives for the patients. Again, from the patient's perspective, the Affordable Care Act will make a lot of screenings free, but it does not make the treatments free. So you can get a colonoscopy for free, but if they see a polyp, if they remove it, now you got to charge that patient. And I actually have a paper I downloaded. They're studying this. They're really worried about the incentives over this. You make patients know the screening will be free, but if you need any treatment, they're going to have to pay. And so again, it's a difficult situation. I don't know. Anyways, we still have problems in that area. I'll leave it at that.
Well, I think Jefferson Healthcare will continue to promote wellness in every fashion that entails, including screening, our education programs for diabetes, our Exercise for Health program. I don't think that the Affordable Care Act is going to change that in any way. If anything, it will just increase our ability to promote wellness in our community. I think that the other areas that we're going to start looking into are obesity, and we can work together with the health department in that area. But I don't see the Affordable Care Act changing what we do, just increasing what we do currently.
Matt?
I think that preventative care is very important because otherwise you end up with a community of people who just go to the emergency room when they really have an emergency and it's more expensive. Sort of going back to what Matt was saying about getting free tests and then having to pay for the treatments, that comes back to being a commissioner and advocating for single-payer universal health care and through the Affordable Care Act, we've been given the opportunity to create that. And I will fight and to work to endorse this and to advise the board to endorse it. And we should be an example for other communities, other rural hospital districts, and taking care of the people who live in our community.
I really don't have anything to add over what Mark said, but we have, I've forgotten the question. I really try to think it, but I can't. What was the question? I'm sorry.
Yeah, go ahead, you can repeat it. Go ahead.
What role do you see Jefferson Healthcare providing more preventative health care services as the Affordable Health Care Act phases in?
Okay, we always have, and this is what I agree with Mark, we always have focused on wellness, but I think what the difference is now is that it's going to be funded partially. So, that's where the incentive lies, is that, now we get some money for it. And so that's a big chunk of it. So before we couldn't do as much as we're going to be able to do now. So.
Clock on the wall says time for closing statements. So Jill, we'll start with you and go down the table.
Thank you. Thank you. For 14 years, I traveled to Washington, D.C. to speak with our congressional representatives on rural health care issues. During those meetings, a mutual trust and respect evolved. This does not happen overnight. I earned that trust over time. During the implementation of Obamacare, there will absolutely be bumps along the road, and Congress will look to trusted leaders like me to help smooth the journey. My opponent, however, says she will spend every opportunity to advocate for a system that does not exist and is not even on the horizon. While altruistic, she is woefully misguided. My mandate as a commissioner is not to change the law, but to work within the system for the betterment of Jefferson healthcare, and it's working. It's what I've done for 18 years, and with your vote, I will do for the next 6. Thank you.
Ben.
I believe that our perspectives are based off of our life experiences, where we come from, where we live, and the struggles of our families, friends, and of ourselves. My opponent has claimed that I am out of touch with reality. I think this is an example of her failure to branch out of her own life and to understand how many realities really exist from Brendan to Port Townsend. When elected, you can be sure that I will use my fresh, engaged, and contemporary outlook to advocate for all of the healthcare realities in our community. I will use my life experiences as an uninsured working person in this county to represent the grossly underrepresented. And I will work tirelessly and relentlessly to advocate to provide health care that we all deserve. A vote for Savannah Hensel is a vote for change.
Mark.
Thank you. Well, I think that Matt and I have actually a similar vision for the hospital, and that is that we provide affordable and excellent health care for everybody in the county. I think that the difference is that Matt has a vision, and I, on the other hand, together with Jill Bueller and Mike Lynn and the rest of the board, have a business plan to accomplish this. It's nice to talk about pie in the sky, but we live in the real world. And at the end of the day, we have to have a plan, and we have to be able to make budget. And so I think that's where I live. Thank you.
And Matt.
Well, one thing is clear. It's clear my opponent won't be voting for me. But I want to tell you some people that are voting for me, and it's many of the Jefferson Healthcare employees, including Dr. Carrie Day of Jefferson Medical and Pediatric Group, Dr. Judy Gaines, hospitalist at Jefferson Healthcare, the director of the Family Birth Center, Kirsten Picard, the director of the Emergency Department, Paula Sorbel, the director of Patient Safety and Quality, the director of Pharmacy, the director of 2 primary care clinics, Joni Knutsford, longtime ACU, ICU director, and current infection control specialist, Laura Showers. These are serious people, and these are only a few. I hope you will appreciate that it takes some courage for an employee to publicly endorse a candidate opposing a sitting member of the board. These employees are sticking their neck out because they believe we need change, they believe in my skills, they care about our community, and they hear what I'm saying and they agree with me. So I hope you will give me a chance to live up to their vote of confidence and elect Matt Reddy, Hospital Commissioner. Thank you.
Let's thank our candidate.